All right. Hi, everyone. My name is Lily, and I'm the Billing and Office Manager here at Community Health Resource Center. Thank you for joining us for our first session of our Chronic Kidney Disease and Nutrition series. Today's presentation will provide an overview of chronic kidney disease, including prevention, risk factors, symptoms, and possible complications. I'd like to thank our partner, the National Kidney Foundation, for helping make this series possible. Before we get started, I'd also like to share a little bit about Community Health Resource Center. There we go. For those that haven't joined our programs in the past, Community Health Resource Center is a nonprofit organization here in San Francisco. We were established nearly 40 years ago by doctors at California Pacific Medical Center to provide resources and care that would supplement their work with patients and support their overall health and well-being. Today, we have 4 main areas of service. Those include behavioral health, nutrition counseling, health screenings, and health education. Today's presentation, or this series, is a accumulation of 2 of our areas of service, including nutrition and health education. We're excited to have one of our own nutrition providers, Elena Zidaru, leading this series. Elena is a registered dietitian and the director of our nutrition team. She is passionate about working in the outpatient setting and supporting her clients achieve their health goals. She provides individualized nutrition counseling for weight loss and disease prevention, but also provides nutrition therapy for people with various medical conditions such as cancer, diabetes, chronic kidney disease, gastrointestinal disorders, cystic fibrosis, and more. Elena also provides nutrition therapy for cancer patients going through chemotherapy at the Brian Hemming Cancer Care Center or radiation treatment at the CPMC Radiation Oncology Department on an as-needed basis. Her goal is to meet her clients where they are in terms of readiness to change and help them set goals that are realistic and achievable to promote self-efficacy and achieving health behavior change. And just as a reminder, the information provided in this presentation is for educational purposes only, and it is not a substitute for professional medical advice. I'd now like to go ahead and pass it along to Doris Liu from National Kidney Foundation to share more about their organization.
Thank you so much. I'm so happy to be here, and we love partnering with you. So let me share my screen. How's that look? Good? Great. Okay. Success. Okay, so my name is Doris Liu, and I am the program manager with patient programs for the National Kidney Foundation. We are a national organization with 23 regional offices. Our office serves the western side of the country, California, Nevada, Oregon, and Washington. Let me just forward this. Oh, where's my forward button? Oh, there it is. So there are 3 main focus to our mission. I just want to highlight the first one, which is to eliminate preventable kidney disease. So kudos to you all for being here, because nutrition and healthy lifestyle choices play a huge part in slowing down and possibly preventing chronic kidney disease, especially in the early stages. So thank you for being here and making the choice to learn about kidney health. The NKF is also focused on accelerating innovation and dismantling the inequities of kidney care. A couple of resources I want to share with you. Here are some resources we have for patients and families. The NKF Cares is a patient helpline. It is staffed by trained professionals who can answer all your questions and provide support. They can send out information to you and are available in English and Spanish. NKF Peers connects you one-on-one with somebody who has been there. Maybe you want to ask a patient, if kidney disease is silent, how did you find out that you had CKD and what did you do? So that is available in Spanish as well. And online communities is a place to ask your questions anonymously or just read other people's questions and read the responses from the community. And just to let you know, we will share all these slides with you so you will know how to access all this great information. We have free kidney health education courses. There's a range of topics, some in video format, which is my favorite way to learn, available in Spanish as well. If you are in the later stages of kidney disease, or you know someone who is, you might be interested in our upcoming webinar next month on Medicare and end-stage renal disease, which just means kidney failure, often referred to as just simply ESRD. So come learn about Medicare coverage for those with kidney failure, regardless of age. NKF also hosts kidney walks throughout the country, throughout the year as well. This event is a fun, inspirational, and very powerful way to show those impacted by kidney disease that they are not alone in their fight. So to find the closest walk to you, go to kidneywalk.org. The Authors Luncheon is a very popular annual event, and it is in person. This year, it'll be at the San Francisco Marriott Marquis, and we bring together top authors to come and speak about their best-selling books. The luncheon also supports the kidney community. And since you're here to learn about nutrition and kidney health, I wanted to share with you our website, kidney.org. Very easy to remember. You can go there, and if you are a patient, click on this box where it says patient, I am a patient. That leads to this page. Click on diet and nutrition, or any of the other boxes you want to learn about. The nutrition page is here. This is a whole lot of information about foods, fluids, recipes, and more. And my favorite feature on here is that you can filter out the recipes to only show the ones that pertain to you and your stage of kidney disease. And so with that, I'd like to hand it over to Elena.
Good afternoon. Welcome everyone to our class series, first week of class series of kidney health and nutrition. I am very excited because I've been doing those class series for the past, I think, 5 or even 6 years, and in partnership with the National Kidney Foundation. And it's been exciting to see that actually we grew the program, and we always kind of update and add more exciting kind of information, and even offering through via Zoom. It's just a way to reach more people. We have them recorded too, so welcome. And I want to say that today, the agenda will be just basically to get familiar with basic kidney function, the role of kidneys, how they work, and what's their role in the body, the difference between acute and chronic kidney disease, stages of kidney disease, and risk factors. We're going to touch a little bit on the healthy diet recommendation overview, but we're not going to go too much into nutrition this week. That's going to be the second week and the third week. I'm going to also talk at the end about the complication of CKD. I know people sometimes want to kind of jump into the nutrition part and right away, but I think it's very important to kind of understand more about the kidneys and the disease to really then be able in week 2 and 3 understand the nutrition recommendations better. So we're going to get started. How do kidneys work? Kidneys are a pair of bean-shaped organs located below the rib cage, and they have an amazing filtering capacity. They filter somewhere around 120-150 quarts of blood in a day. And you could see how much they could filter, because out of that 120-150 quarts of blood, they actually produce about 1 to 2 quarts of urine, which urine is a combination of waste material our body wants to get rid of and fluid, extra water that's not going to get recycled back in the body. And this is happening daily. So it's a lot of work and a lot of credit that we need to give to our kidneys. And you could see here, as I said, how they're shaped, where they're located. Very important, the blood from the body enters the kidney. So this blood will come with oxygen from the heart, and it's pumped into all those filtration mechanism, all those nephrons that are part of each kidney. Each kidney has about 2 to 4 million of nephrons. And then the filtration happens, the urine kind of gets collected through different tubules into through the ureters, and actually will be stored in the bladder. And I think I have a picture here that will show you a little bit more, and kind of be eliminated from the body. And then the blood that will be recycled with certain things that our body wants to keep will come out of the kidneys through the renal vein. So renal artery goes in, renal vein goes out. And then here we have, so each nephron will have this super sophisticated mechanism of filtration, this glomerulus, which is, and this bundle of capillaries, which are tiny, tiny blood vessels. And this is how the blood gets in and gets filtered. Now, but it's very important, and I'm going to refer to this when I'm going to talk more about some of the risk factors for CKD, such as blood pressure, diabetes. So I kind of wanted for you to hold on to this picture and this information here. So the first part of this slide is I just kind of explain in the picture how the blood gets to the kidneys, what happens in and how it goes out. Now, the roles of the kidneys in our body, it's quite, they're different actually roles that kidneys have in our body. So first of all, the kidneys will keep the blood composition stable. So they create this state of homeostasis, of balance in our body. Will keep the pH at a certain level in our body, right? Our body needs to have a certain, not to be too alkaline or too acidic in order to function properly. Also the kidneys will keep a balance of electrolytes in our body, which electrolytes help keeping the fluid in our body in the right places. About 60–70% of our body is water, and that water needs to be in certain places, inside the cells, outside the cells, in the blood. Electrolytes kind of drive that movement of the water, and kidneys keep that balance of electrolytes, sodium, potassium, phosphorus in particular. And again, this will be and will become important as the kidneys are now working very well. What happens with this electrolyte balance? Also, kidneys will make hormones involving blood pressure regulation, such as renin, and also another hormone that's involved in red blood cells production, such as erythropoietin. So sometimes people with advanced chronic kidney disease may have anemia because they're not producing as much of the erythropoietin that's important for red blood cells production. Another role, an important role of the kidneys would be to activate vitamin D in our body, which adequate vitamin D is important for proper calcium absorption from foods and supplements. So without the proper activation of vitamin D, sometimes we don't have that much calcium, and then that means that your body kind of needs to break down the calcium from bones to, to help with the level of calcium in the blood. So that can affect, and that create bone disease and can affect your bones. We have two kinds of kidney disease, acute kidney disease and chronic kidney disease. And the acute one is the difference between acute and chronic. It's mainly that acute one can basically is reversible. And sometimes it happens because of something, maybe a chemical, medication, an infection, something kind of triggered the kidneys to fail and to not work properly, to filter properly. Earlier detection is very important, and once that it's been diagnosed and treated appropriately, the kidney function recovers, and the GFR the glomerular filtration rate will bounce back to where it used to be. The chronic kidney disease, on the other hand, is kidney damage that cannot be reversed. It's a more slow and progressive kind of damage that happens, more in time, not acute onset. Not to say, so it's important to kind of know that this decrease in time of the GFR, can be managed and can be improved to some extent with diet and lifestyle modification. I've had patients that maybe increase their GFR to some extent, but it's not gonna, for example, somebody that has a GFR of 32, they might bounce to maybe in the 40, like a 40 or early 40 GFR, but it's not gonna go back to maybe a 80 or a 90. So it's not, it's irreversible. And our kind of goal with dietary and lifestyle changes once somebody has chronic kidney disease is actually to kind of keep it where it is and not allow it to progress, and possibly to improve it a little bit. Detection of kidney disease. So how do we screen people for CKD? It can be done by a blood test, and usually the blood creatinine levels are going up when there's signs of CKD, and GFR, the glomerular filtration rate, will decrease as the kidney function deteriorates. And this is because basically the filtration capacity of your kidney will decrease, and that GFR that calculates the rate of filtration will be lower. The creatinine and the GFR, or what you see on the lab work, it's an eGFR, estimated GFR, because you calculated. It's actually something that it's part of the CMP, the Comprehensive Metabolic Panel. So it's part of the regular screening that you could do with your primary care physician yearly, which is a good thing, right? Because you could catch things as they happen. And now, a lot of times, depending on the lab, I see it less often, but sometimes they would say normal if it's more than 60, and they don't give you the exact number of the GFR that you have, and would be flagged as abnormal if the GFR drops under 60. But a lot of labs nowadays, I see that they give you the exact number. So if your GFR is 110 versus if it's 90, 80, 70, or maybe, 69, and approaching that 60, versus when they just say it's higher than 60 and it can be 61 and you don't know. So so that's definitely something that I encourage everybody, do your regular screening test with your primary care physician as a way to detect kidney disease. There's also a urine test that can test actually the presence of protein and or blood in the urine. So when you do a urine analysis, they will be able to say if they identify protein or blood in your urine. Usually somebody with healthy kidneys won't have protein or blood in their urine. It's very important to also do the urine test because sometimes, and I've seen it in my practice, sometimes people have the presence of protein in the urine, but the GFR, it's still normal and in a good level. But basically, the presence of protein in the urine, it's one of the first indications that you are at increased risk of developing CKD. So I don't want people to wait until the GFR really drops, right? Like if you have those early signs, it would be good to make already changes. And again, we recommend that those at risk should have their protein in the urine checked annually. I mean, even for screening purposes, would be good to do an annual urine test, especially people at risk, and we refer people with family history of CKD or end-stage renal disease, also people with diabetes and high blood pressure. Symptoms of CKD. So I have a list here, and they're different ones, but overall, I want to mention most people may not have symptoms until their kidney disease is actually advanced. So sometimes it's not necessarily good to just rely on that. I have no symptoms, I have no kidney disease. It's still good to do annually those blood tests and urine tests that I mentioned. You may notice that people would feel more tired, will have less energy, have trouble concentrating, and not a very good appetite, not very good sleep. Sometimes muscle cramps at night can be a sign, swollen feet and ankles because of the fluid accumulation, puffiness around the eyes, especially in the morning, dry, itchy skin, and also they need to urinate more often, especially at night. Those can be symptoms, but also those symptoms can be associated with other conditions. So again, the best way to screen for kidney disease is doing lab work. Now talking about the CKD, as I mentioned, it's a gradual and progressive loss of kidney function over time. It's named a silent killer because more often doesn't have symptoms, especially in the early stages, and doesn't really hurt. You know, you don't feel different. You don't know you have it, and you might have it. I want to mention, and I'll emphasize it multiple times through those class series, high blood pressure and diabetes are the main causes of CKD. About almost half of individuals with CKD also have diabetes and and or self-reported cardiovascular disease, including high blood pressure. There are other causes for CKD. As I said, about half those two conditions, and we'll address more those. But age with age, you know, we expect for the kidneys to not work as properly. Obesity, so extra weight, can be a risk factor. Heart disease, some autoimmune diseases like glomerulonephritis and lupus can lead to CKD. Some inherited diseases like polycystic kidney disease can also, obstruction caused by kidney stones for people that would have recurrent and, you know, again, not very often, but those can be other causes. Tumors, enlarged prostate gland in men, and repeated urinary tract infections, if you have those recurrent ones. That those can affect and create damage in the kidneys. Out of those risk factors, I like to always point out to my patients, just try to focus on the controllable ones. We have the non-controllable, family history or age or race, but the controllable ones are the ones to focus and kind of put your energy in. Diabetes, high blood pressure, if you have those conditions, or like would be good to just try to manage. How do we manage those? We'll talk more in details. Well, it's a combination of taking the prescribed medications and also making lifestyle changes to help you manage diabetes and blood pressure. I want to mention, having those conditions do not really mean, oh, I'm going to get CKD. The actually risk factor having diabetes and blood pressure is when they're not managed properly. So uncontrolled diabetes, when your high blood sugar or the hemoglobin A1C, it's not at goal, or, you know, over the years. The same with blood pressure, is not controlled, and even though you have blood pressure and take some medication, it's still not controlled. Those are usually the ones that will create the damage, right? Like if you control your blood pressure and your diabetes, there's definitely way of a less risk to affect your kidneys. Heart disease, obesity. So again, those are the ones that we want to focus on and try to control better those conditions you have. Or let's say if you're overweight, trying to lose weight, that would be, again, a way to prevent. For blood sugar, I want to kind of give you some tips of how to manage the blood sugar. So first of all, when we have higher than normal blood sugar because of uncontrolled diabetes, your blood is a bit thicker, and actually that higher glucose in your blood will affect your blood vessels. You know, the big arteries, like the ones that go to your brain or to your heart can be affected. And that's why having diabetes uncontrolled can increase the risk of heart attacks or strokes, but also can affect the tiny blood vessels, like the ones I showed you in the kidneys, in that glomerulus. Those can also, the ones in the eyes too, they're very small capillaries and small blood vessels that can get affected, and that actually, it's how it increases the risk of I like to look at the that glomerulus with the tiny blood vessels as imagine like a very dense sieve that filters things. So when those little blood vessels get damaged, either because you have higher than normal blood sugar and stickier kind of blood, or you have high blood pressure in those small vessels that could pop, this is where you kind of create kidney damage, right? Like it's almost like you create holes in that sieve, and that sieve is not going to filter that well anymore in time. You lose some of that capacity of filtration. So going back to how to monitor the blood sugar, first of all, take medication as prescribed. If you have diabetes and you're prescribed medications, very likely, you know, it's not very often that I see that somebody with diabetes can control very well their blood sugar without taking medication. So this is a must. Monitor is directed, right? You might want to do a hemoglobin A1C every 3 or 4 months, the way your doctor recommends, but also you might want to check your blood sugar at home with glucose monitors. Now there are also options of the CGM, the continuous glucose monitors, that can actually help people see better patterns of how my blood sugar is after I'm eating certain things, or certain foods in what combination and in what portions will actually help me control better my blood sugar. So monitoring is very important as part of managing diabetes. Eat regularly. So as far as we know, for better blood sugar control, meal regularity is very important, because we'll keep your blood sugar more regulated and avoid big gaps in between your meals, to avoid fluctuations of your blood sugar, being too high, being too low. So we want to eat breakfast within an hour, maximum 2 of waking up, and then we kind of time the meals and snacks every 3-4 hours thereafter. This way, again, you ensure a more controlled and more controlled blood sugar. Ideally, also for better blood sugar control, is to balance carbohydrates with protein and fats. So you really want to, I tell my patients, never eat the carbohydrate food by itself, even if it's a healthy carb, like a piece of fruit. Try to have a handful of nuts with it. The protein and fats and the extra fiber from the nuts, for example, would really slow down the absorption of the sugar from the fruits. The way I like to say, just for a visual, is that think about if you have a jar of sand and you're trying to pour the sand out of the jar, it's just going to flow very fast and easily. If you put bigger rocks inside the jar of sand, so you put protein, fat, and fiber, those bigger molecules, and you're not having just the sand, which are the sugar molecules, and now you're trying to pour that sand out, it's going to take longer to empty. The jar will take longer to empty. The sand will flow more slowly. And that's exactly kind of what happens. Those protein, fat, and fiber molecules will slow down the absorption of sugar into your blood. So instead of having a spike after a meal that's only carb dense, you will have a nice curve over the course of the next 3-4 hours. Try to choose whole grains when possible, because these digest slower and minimize blood sugar spikes. Again, the fiber, it's something that actually, fiber is a molecule we don't have an enzyme to digest in our body. So it's a type of carbohydrate that we cannot really digest. And will actually not translate into sugar molecules in your blood and will slow down the absorption of the small sugar molecules. I recommend this if you do 50-50, about half of your grains in a day or in a week that you eat in your diet to be whole grains. Limit refined carbohydrates and simple sugars. Again, the carbohydrates, they are not with fiber, what we call more refined or quick starches that will turn into sugar fast because there's nothing there to slow them down. And also the simple sugars, which are basically small sugar molecules. It could be just 1 or 2 sugar molecules linked together. Those digest very fast and they get absorbed very fast in our blood. Simple sugars can be natural sugars, let's say fructose in a glass of fruit juice, or can be added sugars, like any type of sugar that you add to your food or your coffee or your tea. Can be table sugar, can be honey, can be maple syrup. They're all going to turn into glucose into your blood, and they're considered added sugar because we add them to foods. They're not occurring naturally there the way fructose will be in fruits. So limiting those, again, I'm really not a proponent of you should take things out of your diet. You should just kind of know how to eat, how much to eat, and how to pair your foods for the best blood sugar approach. But definitely limiting, not avoiding, but limiting those foods would be helpful. Exercise regularly. Exercise, it's a wonderful way to actually manage blood sugar and lower blood sugar. When we contract muscles, the sugar from the blood goes inside the muscle cells to fuel and does not really need insulin to facilitate that and entering in the cells. So it's a really nice way to lower your blood sugar after a meal. Maybe take a walk. Control the amount of carbohydrates consumed in each meal and spread them evenly throughout the day. So that's what we call a more carbohydrate controlled diet. So it's not about not eating the carbohydrates at all if you have diabetes. It's actually a good idea to give your body a limited, controlled, and evenly spread carbohydrate load throughout the day. So then again, you keep your blood sugar nicely regulated without spikes and without dips. So you want to have a certain amount of carbs with each meal. We usually say 30 to 45% grams of carbohydrates per main meal, which can be somewhere between 2 to 3 servings of carbs. We can talk more in detail in the next weeks. For blood pressure, the goal would be for CKD under 130/80. So systolic and diastolic numbers. How to manage blood pressure. Again, take medications as prescribed by your doctor. Check blood pressure regularly. Ideally is to have to monitor at home as well as at the doctor's office. Exercise regularly. Exercise also helps actually lowering blood pressure. Manage stress. We know stress can increase blood pressure, unfortunately. So finding ways to, again, there's no way we can eliminate or control the stress in our life. Sometimes it comes uninvited, but it's how we react to that stressful event or incident. How we react actually and to eat would make a difference. And how can we find ways to actually balance the stress in our life, you know, making time for certain things, taking breaks, or you know, treating ourselves with different things in a day, just as a way to kind of reduce the stress that's coming. Reduce sodium is another way, which sodium is one of the electrolytes and minerals that are part of our body. Every single cell has it, and it's a way to control the fluid, right? Like sodium likes to hold on to the water. So when we have a lot of sodium in our diet, a salty meal, or just eating a lot of processed foods, there's definitely accumulation of fluid in your body that increases your blood volume and can increase blood pressure. That can create more edema and accumulation of fluid in different parts of your body. And I think a lot of my patients kind of see that even when you don't have necessarily high blood pressure, but if you had a high sodium meal, you see that over the course of the next 2-3 days, maybe your fingers are more swollen, or people that monitor their weight regularly tell me, oh, I have 2 extra pounds all of a sudden, and it's more like fluid retention. So definitely sodium has this ability to hold on to the water and can affect our blood pressure, can increase blood pressure. Fortunately, sodium also in people that do not have blood pressure can affect in time, if you have a lot of sodium in your diet, can affect the elasticity of the blood vessels. So in time will make your blood vessels more stiff, which can actually increase the risk of high blood pressure. Because think about stiffer blood vessels would create more pressure into your blood vessels. I use this example of pressure at the end of a hose. Imagine if that hose won't be having stiff walls and would be kind of all elastic, you won't have any pressure at the end. So that stiffness of the wall and that resistance, that when the blood is pushed from your heart with a lot of speed, if your blood vessel is stiff, it will create more pressure. If it's more elastic, it won't create that much pressure. So sodium overall, too much in our diet won't be a good thing, regardless if we have or not high blood pressure. DASH diet is one diet that's been more studied, and we like to recommend for blood pressure management. It stands for Dietary Approaches to Stop Hypertension. And there are different studies that show can be very effective in controlling blood pressure. And that DASH diet, actually, it's a lower sodium diet, but also it's lower in saturated fat, sugar, and it's high in fruits and vegetables, legumes, whole grains, nuts, and seeds, all those plant-based foods that actually have more anti-inflammatory properties and more potassium. And it's been shown that with less sodium and a bit more potassium foods from those plant-based foods, this was a way that achieved, from a dietary perspective, the best management of blood pressure. So it's a diet that we recommend. Now, going into the stages of CKD, so they're mainly based on the estimated GFR. So again, the GFR is the rate at which the blood is filtered through the kidneys every minute. And GFR is calculated using a formula. Blood creatinine is needed in that formula along other factors. So that's why it's a eGFR, because it's estimated, it's calculated through a formula. Normal GFR ranges from 90 to 120. And we could see here the stages and how they're actually delimited. So stage 1, which is actually, it's considered some kidney damage, but with normal kidney function. That means your kidneys are, oops, sorry about that. Your kidneys are actually functioning at 90 to 100% capacity. So it's really the kidneys are not affected. The kidney function is not affected. Then you have stage 2, which shows mild loss of kidney function. So that means your kidneys are at 60 to 89 capacity. And this is still, really good. And what I want to say is that a lot of times people, and I know that from my patients, a lot of times people in stage 2 with this GFR, they're not even aware that that's stage 2 CKD, you know. They are never told that they have CKD, or nobody seems to kind of address that. So that's why it's kind of good to know. And if you have diabetes, for example, and you're a stage 2, would be good to kind of consider what can I do, what changes can I make, or how is my blood sugar control. Two of the main wonderful things people can do if they have diabetes and high blood pressure is just control better those conditions and achieve good numbers for hemoglobin A1C and for blood pressure. And that will ensure that there's not going to be further damage happening to your kidneys. Stage 3A, which is mild to moderate loss of kidney function, is between GFR 45 to 59. And again, your kidneys are working at a 45 to 59% capacity. And stage 3B, moderate to severe, between 44 to 30. So stage 3 is divided into, because it's a big stage, it has like 30, it's between 30 and 60 basically, or 59. And then we categorize it as A, mild, moderate, and B, moderate to severe. Stage 4 is a more severe loss of kidney function, which your kidneys are filtering at 15 to 29% capacity. And stage 5, it's considered kidney failure or end-stage renal disease, ESRD, when basically GFR is 15 or less. And a lot of people in this kind of stage already are in discussions with the nephrologist about starting dialysis or getting prepared for that. So you see how important it is to, when we think about more prevention in a way to slow down the progression of the disease, how important it is to intervene stage 2, 3A, 3B, and even 4, right? Like just to avoid that, that stage 5. Stage 5 CKD options are going to be hemodialysis, peritoneal dialysis, which gives you a bit more flexibility because you can do it at home, and then kidney transplant. So those are the main 3 options. And this is what we want to actually, with this class series, we want to prevent and avoid people getting to the stage 5. And also, unfortunately, this class actually focuses more on those early stages to prevent this from happening. So I'm not going to talk today about hemodialysis or peritoneal dialysis or kidney transplant. Ways to prevent and manage CKD. So increased physical activity, of course, if you need doctor's guidance for that, but physical activity will help you, would help with CKD prevention. And also, as I mentioned, if you have diabetes and high blood pressure, and those are the main causes of CKD, then physical activity will help with actually controlling better blood sugar and blood pressure. Limiting sodium, it's an important part too. Controlling blood sugar, the way I said, and controlling blood pressure, very important. Lose weight if you're overweight, because as I said, weight can be one of the risk factors that's not part of diabetes and high blood pressure. With smoking and alcohol consumption, to kind of limit to 1 drink per day if you're a female, and 2 drinks per day if you're a male. So trying to use alcohol in moderation, because those also, smoking and alcohol consumption, were linked with increased risk. And then modifying diet, again, more to come next week about possible further restrictions like protein, sodium, phosphorus, potassium, depending on what stage you are and how your labs look like. You want to address mainly those 4 nutrients, but making some diet modifications. There are definitely benefits of nutrition intervention, and research shows that medical nutrition therapy has a role in slowing the progression of CKD, delaying the need for dialysis, and improving nutritional biomarkers. So Nutrition can help at any stage. Again, the sooner you intervene, the better. Nutrients of concern that we're going to talk more next week, sodium, phosphorus, potassium, protein, and fluids. I'm not going to spend more time on those. And I would like to get into the last part of the presentation for today, complications of CKD, and leave some time for questions at the end. So there are some complications of CKD that are listed here: gout, anemia, metabolic acidosis, secondary hyperparathyroidism, bone disease, and high phosphorus, or also called hyperphosphatemia, heart disease, hypotassium or hyperkalemia, and fluid buildup, also known as edema. So those are all complications of CKD, and we'll talk one by one. So gout. CKD increases the risk for gout, but also gout can lead to CKD. And so it's a little bit of a reciprocal relationship. The gout is a type of arthritis that causes swelling and pain in your joint when uric acid accumulates in your blood. And how uric acid is actually made from purine breakdown, which are some purines are part of our body, but they're also in a lot of foods. And they need to break down right in your body. And if you have gout, it's very likely you have an issue with metabolizing those purines properly. And as I said, those, when they break down, they create uric acid, and that uric acid can accumulate in or build up around the joints under the skin. They kind of look like sharp crystals, and they're very small, and they can cause a lot of pain and swelling, inflammation, stiffness, redness. So that area becomes warm, and it happens very often. Fingers, toes, those parts of the body, but it can be definitely a painful condition. And part of the gout management is to avoid foods that are very high in purines and avoid alcohol. Adequate hydration is important, like drinking more water can help prevent those crystals from happening accumulating in the joints. Again, you very likely need to take some medications recommended by your doctor. Can be anti-inflammatory, non-steroidal anti-inflammatory. Colchicine is one that's prescribed, and steroids sometimes. Ice packs will help to keep the joint cool, elevating the affected joint, and then keeping pressure off the affected joint can also. But from a diet perspective, which I would go a bit more in detail, avoiding high purine foods. And I listed the ones that are pretty high in purines that I tell people try to avoid if you are susceptible to gout and you have gout. It would be a good idea to try not to have those foods. Anchovies, asparagus, animal organs, liver, herring, gravy, which concentrates the purines in meat, dried beans and peas, mackerel, mushrooms, mussels, sardines, and scallops. So those are the foods with the highest level of purines. A lot of protein foods will have purines, including your regular healthy fish, chicken, red meat will have more than chicken and fish, but these have purines too. And of course, you still need to eat food and get your protein somehow, but limiting the servings of meat or chicken or fish to 2 to 3 ounce serving, which would be the size of a deck of cards. That thickness and that size would be about 3 ounces. So 2 to 3 ounce per meal would be a way to kind of manage the purine intake. Again, adequate hydration, as I mentioned, it's important. Avoiding alcohol, maintaining a healthy body weight. Again, being overweight, it's associated with gout, and maintaining a good healthy body weight would be a good way to manage gout. and then eat regular meals. Try to eat every 4 hours. They've been shown that when people skip meals and have big gaps in between the meals, that could exacerbate gout. Anemia is the second complication to talk about. It's common in people with CKD and usually worsens as CKD worsen. And the reason is because then your kidney, as the damage progresses, will lose the ability to create, to secrete erythropoietin, that hormone that I said will signal your body to make red blood cells. We make new red blood cells every 120 days, more or less. So we recycle them, and that hormone is the one that drives this process. Red blood cells carry oxygen throughout the whole body, and they're very important for us to keep our organs and tissues well oxygenated and functioning properly. As kidney function decreases, as I said, you might not make enough of this erythropoietin, and you'll have less red blood cells to carry oxygen. People usually feel tired when they have anemia. It's a general state of malaise and not feeling well overall. Those are all the symptoms: tiredness, fatigue, pale skin, dizziness and not being able to focus well, shortness of breath, chest pain, and cold intolerance, so not tolerating very well cold. Management, well, again, if this is the cause of your anemia because your kidneys are affected and they're not making enough erythropoietin, this erythropoiesis stimulating agents are prescribed, so they will kind of act as the hormone, right, to stimulate and tell your red blood cells to be produced. Sometimes iron supplements are needed. If on dialysis, you might get an iron supplement during your treatment. And then sometimes people need red blood cell transfusions. Metabolic acidosis is a buildup of acid in your body. Remember, I said the kidneys have this role to maintain this balance of pH, acidity, alkalinity in your body. And if you have a buildup of acid in your body, that's the metabolic acidosis. Symptoms will include feeling tired and weak, having nausea, vomiting, decreased appetite, fast heartbeat, headaches, people needing to take long and deep breaths, and definitely not a good state. And the consequences of metabolic acidosis will actually, it can worsen CKD. So it can produce more, like further damage of the kidneys, muscle loss, osteoporosis, endocrine disorders, inflammation. So again, not an ideal state to have. And as part of management, sodium bicarbonate, which is more alkaline, is usually prescribed. Is not appropriate for some people who need to restrict sodium. Obviously, it's something that will take if the doctor recommended, not just taking sodium bicarbonate on their own. Also, from a nutrition perspective, they shown that replacing animal-based protein with plant-based protein may lower acid load in your body. We know that plant-based foods, which would be fruits, vegetables, legumes, nuts and seeds, and grains, particularly whole grains, those actually have, when we have more in our diet, we create more alkaline urine in our, so our urine will be more alkaline. When we have more animal type of foods in our diet, including meats and chicken and fish and, dairy products, you increase, you make your urine more acidic. So it makes sense when you have this metabolic acidosis, trying to have more plant-based protein and limit a bit more the animal products will help that acid load, to reduce that acid load. That is why also overall we recommend a Mediterranean plant-based diet. for healthy kidneys, and especially for people in the early stages when they don't need to restrict that much certain electrolytes, to use more plant-based foods as a way to keep the kidneys healthy, because you don't have that much of an acidic load to put on your kidneys. So plant-based proteins can include the nuts and seeds, can include tofu, tempeh, soybeans, edamame beans, or other legumes, dry beans of any kind, from lentils to kidney beans to pinto beans, black beans, and certain grains like quinoa are actually a very good source of protein, and those can be used too. The secondary hyperparathyroidism is basically an oversecretion of the parathyroid hormones that's secondary to kidney failure. So basically, when because of more advanced kidney disease, and your kidneys are not activating that vitamin D the way I said. One of the role of the kidneys is activation of vitamin D. So when that doesn't happen and you have low vitamin D in your body, you're not absorbing properly the calcium, and you have low calcium, which can increase that parathyroid hormone secretion. And when you secrete too much of that hormone, what happens in your body is more calcium is pulled from your bones as a way to increase that blood calcium that's low. And basically that can damage your bones. You get more bone loss. So osteoporosis can be a consequence, or bone and joint pain, kidney stones, urinating more often, loss of appetite, feeling weak. So those are all symptoms. But the biggest consequence of the secondary hyperparathyroidism is the bone disease that can happen. Management would be taking the vitamin D and calcium to help with calcium absorption. Some people, again, if your kidneys are not activating vitamin D, you need to take an active form of vitamin D, and because you can't rely on your kidneys to activate. So calcium mimetics are another option, which they tell your parathyroid to make less of that hormone. So they kind of mimic the calcium, but they're not calcium, just basically to avoid pulling the calcium out of the bones. Bone disease and hyperphosphatemia, which basically is higher than normal phosphorus in your blood. Phosphorus can accumulate in your blood as kidney function decreases, and basically more phosphorus accumulates, and then in the light of low vitamin D and low calcium and increase in that parathyroid hormone, basically you could see how you're getting more calcium pull off the bones, and you could this can lead to bone disease. So it's this kind of vicious cycle that happens. I want to talk a little bit about sources of phosphorus, and we'll talk more in week 2, which is next week. Sources of phosphorus in our diet include protein foods, mainly like chicken, meat, fish, nuts, beans, milk and cheese, but also some foods like wheat bran and whole wheat will have more phosphorus than, let's say, white bread. However, phosphorus in foods is not very absorbable, and we'll talk more about next week. It's at least not as absorbable as the phosphorus in phosphate additives that are added in processed foods. So those are also a good source of phosphorus in our westernized diet. We have lots of processed foods with phosphate additives. They add phosphates in foods for different reasons. That would be more, to extend the shelf life, to avoid caking of the, if it's something powder, spice, or let's say a pancake mix or things like that. adding those phosphate will help for that powder to not cake and harden. So a lot of times they're added for those reasons, but again, those can be a very good for a source of phosphorus in somebody's diet that has CKD. And unfortunately, also, this type of phosphorus is highly absorbable. It's way easier to absorb than the natural phosphorus in foods that tends to bind with other nutrients and not be as well absorbed. Certain drinks like dark color sodas, like colas and cocoa, beer, milk, instant tea, all those also are high sources of phosphorus. Like Coca-Cola has that phosphoric acid in it. And some medications also can have phosphorus. So it's good to be aware of all those. Management would be to limit the phosphorus you eat and drink, mainly pay attention to phosphate additives in foods. As I said, they're highly absorbable. Take phosphate binders with your meals. People sometimes are prescribed those phosphate binders, which you take when you eat. So then the phosphorus that you eat in food will bind with those binders and get flushed out from your body, so it doesn't get absorbed in your blood. Take a calcitriol supplement, which is an active form of vitamin D that helps increase calcium absorption in your intestines and keeps your vitamin D level at a good range. Exercise daily, which helps your body get rid of some of the phosphorus. So exercise, again, I want to emphasize, is one of important part of kidney health, regular exercise. Oh, I went back by mistake. I apologize. Heart disease, CKD increases the risk of heart disease, but also heart disease increases the risk of CKD. So again, another reciprocal kind of relationship, the same as gout. So some complications of CKD can increase the risk of heart disease, such as anemia, high blood pressure, high homocysteine levels, unbalanced phosphorus and calcium levels. Also, prevention will be to manage weight, blood glucose, blood cholesterol, blood pressure, keep that phosphorus calcium balance as well as possible. So this would be prevention. Following a healthy diet that's low in saturated fat and sugar and is more plant-based and higher in fiber, which are the plant-based foods. Watch sodium in your diet, exercise regularly, take meds as prescribed. Sometimes we need to take medication to lower blood pressure or cholesterol, and try to manage stress the way I talk about also with the blood pressure. High potassium hyperkalemia is when, again, potassium accumulates in your blood because as your kidneys are, the kidney damage increases, the ability of actually filtering and getting rid of the potassium is decreased, and potassium accumulates more in your blood. Symptoms of hyperkalemia would be feeling tired, weak, nausea is one of them, muscle pain and cramps, and unusual heartbeat, which is arrhythmia, right? It's irregular and unusual heartbeat. Sometimes people can have trouble breathing and chest pain. Management would be low potassium diet. You need to lower the amount of potassium you get from the foods, and medications like potassium binders. The way we have phosphate binders, we also have potassium binders that can bind potassium from the foods you're eating. The last one would be the fluid buildup, edema. As kidney function declines, extra fluid accumulates in the body. That increases your blood pressure, puts more strain on your heart and your lungs. And usually symptoms are faster heartbeat, swelling of your feet and ankles. Most people can tell when they have, especially in their extremities, when they have edema. Management, sometimes fluid restriction is needed. People need to track their fluid intake and remember that certain foods like ice cream or soups or popsicles, they count as fluid, and they don't need to track only what they're drinking, but also what they're eating that's considered a fluid. low sodium diet is very important because, as I said, it just sodium holds onto the water and really helps the accumulation of fluid in the tissue. And again, most people need medications such as diuretics, also known as water pills, that would help kind of get rid of the fluid on a regular basis. Next week, we'll talk about nutrition recommendations for CKD. We're mainly going to cover the nutrients of concern, different types of diets that can be helpful, but nutrients of concern such as protein, sodium, phosphorus, potassium, all those that I listed earlier. We're going to spend some time and talk a little bit about those new weight loss drugs and share some information with you. Also give you some nutrition tips if you're on them or want to use them, how to be more successful. I have a lot of patients that I work with currently on those medications, and there are definitely certain things that I learned from my experience with working with them, but also what we know so far. So that would be part of next week. And I would like to open for questions since we still have about 20 minutes left.
Great. Thanks, Elena. I'll go ahead and put my screen up and I'll go ahead and start with the first question.
Yeah.
Okay.
And I want to mention actually that some people sent some questions that we actually, Lily was nice enough to compile all those questions and categorize them. I have some questions here also that some of them I consider they were probably answered through my presentation today. I will address some of them that pertain to the information I presented today. So we still have plenty of other nutrition questions that will be addressed in the next two classes. But and then there are actually some specific questions about medications that it's not my scope of practice, and I'm not an expert in medications. I'm not a doctor or even a nurse. So what we decided to do is have them, actually Doris said that we could maybe have a nephrologist kind of answer those and send an email about those questions that pertaining to medications.
Yeah, thanks for that disclaimer, Elena. All right, first question, and this is something that you addressed, but I'll go ahead and pose the question. It was entered in our Q&A. What can be done through nutrition to reduce phosphate intake?
Yeah, and we'll definitely talk more in detail from a nutrition perspective next week, but phosphate binders are an option as medications. Exercise, as I said, can help, and then again, eliminating, depending now, I tell people try to check nutrition labels and look for phosphate additives that are highly absorbable. And then the last resort would be to limit some of the phosphorus in your diet. However, and I'll talk more about next week, you'll see the high phosphorus foods are high protein. And as you want to limit the protein, you kind of diet-wise going to be able to limit the phosphorus. But I would pay attention to the phosphate additives in particular and read labels. Make sure on the ingredients list, there's no phos word, because they usually come in different words, monocalcium phosphate, or well, as I said, I'll have separate slides next week, more in detail.
Thank you. All right, next question. This was a question related to the slide on diabetes, I believe. But why is it so important to eat within an hour of waking up? It sounds like this person typically eats within 5 hours of waking up and wonders what the consequences could be if this behavior is continued.
Yeah, and it's a good question, and especially in the light of I have also a lot of patients that do and try to do overnight intermittent fasting, which allows a bigger gap of hours of fasting from the night before to the morning, which can be helpful with different things. I'm usually more cautious when patients have diabetes and take medications of diabetes, because a lot of times they need to take them in the morning, and if you don't eat, that can create some issues, and can make your blood sugar drop, and can create more irregularities in your blood sugar control, or in the blood sugar pattern that you have. So ideally, we know that as you start your day with eating within that first hour of waking up, you regulate better blood sugar, you jumpstart your metabolism. If people engage in because of lifestyle or because they really want to do intermittent fasting and they have diabetes, I highly recommend to monitor your blood sugar, especially in the morning, and make sure, ideally if you have a CGM and you could see patterns, because sometimes people are in the low, especially the ones that I have with CGM, they notice some low blood sugar patterns. And again, it can be just overall more dangerous for you.
Great, thank you. All right, next question. This one has several parts. Can you have proteinuria with significant weight loss due to muscle wasting? And then there were a couple of other things. Muscle wasting and weight loss done in an unhealthy way, such as skipping meals.
Yeah, and it's a good question, and I'm not aware that can happen, that you would have protein in your urine because of that. There might be other labs that can be affected, but as I said, I'm not a doctor necessary to know the answer to that question. To my knowledge, I'm thinking that probably not, but I'm not 100% sure. We might need to put that question on for the nephrologist, maybe.
Yeah, I'll add that one to the list, but thank you, Elena, for sharing the
It's an
information that you
interesting
do
question.
have. Yeah, definitely. All right, next question. How can parents with diabetes help prevent their children from developing the same condition?
Yeah, it's a good question. I mean, kind of healthy lifestyle, promoting healthy habits like exercising regularly, trying to have a good balanced diet with, high fiber carbohydrates, some healthy lean protein, some healthy fat, vegetables. That can be helpful, but very important if somebody would be at risk just because their parents had diabetes. I would say making sure screening, as they, talk with your doctor, because I don't know exactly the recommendations for screening in children, but with adults in their 20s, you could do annual screening labs with your PCP, even if you're healthy, right? That's the purpose of trying to screen for diseases that can develop and try to catch that as early as possible. So having those regular screening in place, I think, would be a way to monitor and overall a healthy lifestyle.
Great. On a similar topic, how can CKD and diabetes be managed together, if you don't mind reviewing that again?
Yeah, so if they're coming together, that's kind of a two-part thing. So first of all, to protect your kidneys, you need to manage your diabetes as well as possible. So kind of taking medication, controlling your diet, being active as a way to manage that blood sugar better, that would help managing CKD basically, or managing, I want to say, not allowing the CKD to progress, right? And then on a separate note, what's different from diabetes with CKD is, and we talk about next week a bit more in details, is you want to basically make sure you're not overeating protein, not having a high protein diet. I would use a Mediterranean plant-based diet, which, half a plate vegetables, the other half split in half, a quarter a healthy high fiber starch and a quarter the lean protein. And this would be 75% plant-based in between your vegetables and your starch. This would be good for blood sugar control because the starch is limited to a quarter of a plate. This would be good for your kidneys. This would be not high in protein. Again, the protein on a quarter of a plate is basically 3-4 ounce maximum, and that will ensure not overdoing protein. And I think that kind of diet would be a way to go to manage both.
Got it. Thank you. Okay, next question. It sounds like somebody's CKD dietitian has recommended a plant-based food program. So they've been eating more beans and peas, but now uric acid is up. Do you have any input on that?
Yeah, and as I probably you saw in the slide with the gout that beans and peas are high in purines and can lead to increased uric acid. Now, the question is, like harm and benefit assessment. Those are wonderful plant-based proteins that can be still used. And the question is that elevated uric acid. I mean, kind of like talking with the doctor more about in the context of, do I have gout and symptoms, I'm in pain, or this uric acid is maybe slightly elevated, and what does it mean? And understanding, again, this harm and benefit assessment a little bit better. I would say if it becomes problematic in the sense that, yeah, it translates into gout attacks and not overall being good for your health, you could try to have as a plant-based protein. I mean, plant-based diet, and I'll talk more next week, it's an umbrella of a term. Again, doesn't mean necessarily people need to become vegan and use only plant-based protein. Maybe you could find a good balance of, limiting the animal protein to a quarter of a plate, having more lean chicken and fish and shellfish, maybe using some eggs sometimes for protein, and tofu and tempeh more often than beans and peas, and relying, or maybe quinoa, and relying a little bit less on those particular high purine foods without necessarily not having them at all, but not making them your main type of protein on a plant-based diet, if it makes sense. Because as I said, plant-based diet, you could still have some animal protein, it's just the ratio on the plate and the percentage of the plant-based foods versus animal-based foods. And I think this would be a healthier way to kind of manage this situation.
Great, thank you. Next question, is intermittent fasting okay for people with healthy kidneys, or best to avoid and try to eat every 3 to 4 hours?
It's a tough question. So for
Let me know
healthier,
if you need
for a healthy individual, let's say not having diabetes, not having CKD, I don't think we have necessarily that evidence yet. I mean, intermittent fasting seems to be because, again, the research goes back and forth. We have different regimens and different kinds, and it's hard to compare apples with pears, with oranges, with peaches, right? Because there's so many versions of intermittent fasting, and we really don't know that much in terms of a more long-term effect on health. It seems to be beneficial to certain things like lowering blood cholesterol, let's say lowering blood sugar if you're pre-diabetic and trying to prevent diabetes, or weight loss. I mean, we have a bit more of that, but we really don't know. I've noticed also sometimes people, it can increase the risk of gallstones development when you're having the intermittent fasting. But again, that's not also clear how much more at risk people are. And again, it's hard to know in a healthy individual the exact effects on health right now. I would say I usually don't recommend it out of like just say, oh, you should do intermittent fasting. If people want to do it and they're healthy, I can be supportive and we can give it a try. And I'm trying not to do the extreme, maybe 13 to 15 maximum hours. Not have, still for people to have a breakfast, but maybe a bit later. Just because, as I said, we really don't know that much about it yet, especially in terms of long-term effects.
Got it. Thank you. I think this one is a good follow-up to the intermittent fasting question. If you don't have diabetes or high blood pressure or obesity, but you do have CKD, is it recommended to eat every 3 to 4 hours?
Yeah, that is a good question. In general, I say, and again, I'm not sure if it refers to the intermittent fasting, I would say for a healthy diet, we want to have 3 meals a day, and we want to have them spaced around every 4 hours. It can be 3, it can be 5, depending who you are and how your meals look like. But ideally, just because that mimics physiologically what happens with our blood sugar and our hunger response in the body, right? Like if you, on a regular basis, most people every 4 hours get hungry, and 3 meals, again, a day should be, for most people, the norm if they're healthy. Again, if you're diabetic, you might have a little bit more often, right? Depending, maybe a snack in the afternoon. But I think for most healthy people, 3 meals would be kind of the norm of a healthy diet. And I know, as I said, there are lots of ideas right now circulating with the intermittent fasting, with the, just fasting by itself and not eating a day or 2 or even 3 at a time. And I've seen all kinds of different patterns and different diets. And the reality is that we don't know how safe those are. We really need much more research and more time to establish if those would be healthy dietary patterns long term.
Got it. Thank you. Let's see. I know we have just a few minutes left, so I'm gonna try to kind of group some questions together. This one I'll combine too. What can be done if A1C and weight are going up instead of going down? Aside from like meal prepping and exercising regularly. And then as a second part to that question, we have a question about Ozempic or the GLP-1 inhibitors for those who are overweight with chronic kidney disease. And I know we'll talk more about that next week, but I'll let you kind of take it away there.
Yeah, and we'll talk about more next week, but so far the trials that are, and there's some more ongoing trials on those GLP-1s and CKD patients and how, but it seems to be helping, right? With the weight loss, but also there's some studies that showed the decrease albumin in the urine, albuminuria, a decrease in the GFR decline. And those studies are still, we'll probably have to know more and do more research because those medications are still quite new. But basically the preliminary results that we have on those medications, CKD, for people that are overweight and need to lose weight, seem to be positive so far, definitely. So as I said, we'll talk more next week. And what was again the first part of sorry, I kind of got sidetracked.
Yeah, no worries. I know it was a loaded question. Let's see. What else aside from meal prepping and exercising regularly could you suggest for somebody whose A1C and weight are difficult to manage?
Yeah, there's always definitely room for improvement when it comes to diet, exercise. But if one kind of felt like, well, I'm doing almost everything I could, and again, those medications can be an option, right? Especially if you are diabetic and you need to lose some weight, or you have some extra weight, right, to lose. I would say having the help of those GLP-1 medications can be an option as a next step, because in general, you know, with diet modifications and exercise, we tend to see a drop in the hemoglobin A1C, and if you see an increase, that means you probably need a bit more help.
Right, Elena. Last question. Can sweating more reduce the work on your kidneys or the stress on your kidneys?
Not that I'm aware of. So just for somebody that's sweating more.
They might be they might be referring to like sweating from exercise. I think this question was added during your discussion around fluids as well.
Well, I typically say, again, adequate fluid intake is important for kidney. We say in general, most people need about 8 cups of fluid in a day. Again, water and other fluids added together, you know, broth or soup or tea or whatever people drink, milk. So 8 cups a day. Now, I tell my patients, if you exercise a lot and sweat a lot, you might need more, actually, you know, sometimes much more, right? Depending on your activity level. Again, the temperature, like if you sweat a lot because it's hot where you live, and yeah, you're gonna need more. So 8 cups is just kind of baseline in normal state. But if you sweat a lot for different reasons, and you lose more water through your skin, you want to kind of bump that fluid intake to 10, 12 cups a day. So yeah, drink more for sure. And as a way to just keep hydrated and not, you know, not have, to keep this adequate hydration state that we say it's healthy for your kidney.
Thanks, Elena. Well, that kind of closes out our Q&A session for today. Like I mentioned, I will save any unanswered questions for next week and the following week. So I apologize if we didn't get to your question today, but we will do our best to get to it next week. Again, thank you everyone for joining today's session on chronic kidney disease and nutrition, and thank you to National Kidney Foundation for partnering with us on this series. As a reminder, this is a 3-week series, so we do have 2 more sessions next Thursday, August 22nd, and Thursday, August 29th from 3:30 to 5 p.m. So we hope you'll join us. Again, thank you all and have a great evening.
Thank you.